Every day in hospitals around the world, patients recovering in general wards suddenly crash. A routine recovery turns into a frantic race to save a life. Often, by the time the rapid response team arrives, the damage is irreversible. For decades, catching these quiet declines relied entirely on manual spot checks. Nurses take vital signs every few hours, calculate risk scores by hand, and hope to spot a dangerous trend in the data before it's too late. Hospitals attempted to fix this with automated bedside alarms, but that created a new hazard: alert fatigue. Alert fatigue occurs when constant, often false alarms desensitize medical staff, causing them to tune out or ignore warnings entirely. What if a silent, automated artificial intelligence could predict a patient's death long before a human could? The barrier to saving these lives was never a lack of patient data. The real bottleneck was the human inability to process millions of chaotic, real-time data points to see a disaster coming. This bar graph shows the staggered deployment of a new predictive artificial intelligence model across 19 hospitals over a 3.5-year period. Researchers rolled out the Advanced Alert Monitor, or AM, a predictive AI that calculates patient risk scores continuously in the background. This flowchart outlines the massive scale of the operation. The system continuously scanned the electronic medical records of hundreds of thousands of hospitalized adults, looking for hidden patterns of physical decline. Instead of relying on a single reading, the AI scanned laboratory tests, health histories, and vital signs, updating every hour. Crunching these variables, the machine identified high-risk patients 12 full hours before a crash. A 12-hour head start turns inpatient medicine from a reactive panic into a proactive rescue. Introducing another computer system to a hospital floor usually means adding more beeps and worsening the alert fatigue that exhausts clinicians. To prevent this, the hospital implemented a unique workflow. The predictive AI operated in total silence, completely hidden from the bedside doctors and nurses. The AI routed its 12-hour warnings to a dedicated, off-site team of highly trained registered nurses who monitored the system remotely. These remote nurses performed an initial chart review. If the machine's warning proved valid, they contacted the rapid response nurse on the specific hospital ward to initiate a structured assessment and alert the patient's physician. By placing a human expert between the machine and the ward floor, the system shielded frontline doctors from raw noise. They only received verified, actionable warnings. Researchers compared the outcomes at hospitals where the silent AI system was active against standard care hospitals that relied on traditional, unalerted monitoring. The intervention led to a massive 16% reduction in patient mortality within 30 days of an alert. Translating that percentage into human terms, the model successfully saved an estimated 520 lives every single year of the study. Patients who triggered an alert and survived were also significantly less likely to be admitted to the intensive care unit, or ICU, a specialized ward for the most severely ill patients, and they had shorter overall hospital stays. Often, new healthcare technology simply adds more screens and administrative exhaustion to an already burdened staff. This silent guardian system operated almost entirely in the background. Carefully integrated technology does not have to replace frontline healthcare workers or make their daily routines more chaotic. The utility of artificial intelligence in medicine lies in its ability to see invisible trends in the data. By crunching the numbers in the background, it grants human doctors the one thing they need most to save a life: time.
This study, titled Automated Identification of Adults at Risk for In-Hospital Clinical Deterioration, was conducted by Escobar and colleagues at Kaiser Permanente. If you want to explore the full paper, it's linked in the description.